It is my honor and my pleasure to thank you, Sir Knights, for your sustained commitment to improving vision for patients, not just here in the United States, but around the globe. The Academy is very proud to partner with the Knights Templar Eye Foundation, a partnership for patients that started 25 years ago. In a minute, you'll hear from ophthalmologists and volunteers who will share the impact that your sustained support has made in the lives of our patients and our communities. The Academy is the largest ophthalmology organization in the world with over 32,000 global ophthalmologist members. We share a similar mission with the Sir Knights to develop resources in education, research, and public service to enhance access to the highest quality care around the world. Thanks to you, the One Network, the Academy's global platform for ophthalmic education is accessed millions of times each year by ophthalmologists seeking assistance. Picture the resources of an entire medical profession: scientific journals, diagnostic tools, multi-volume texts, and surgical videos updated daily and accessible and completely searchable on a smartphone or on a computer. Ophthalmologists, whether they're in Des Moines, Iowa or Lagos, Nigeria, use it to save sight. You have helped make this possible. Your support of the IRIS Clinical Data Registry has helped develop the world's largest secure data bank of patient disease information that, through artificial intelligence, is transforming public health research into eye disease. And finally, with your long-term support and dedication to the Academy's public service program, iCare America, we connect volunteer ophthalmologists and patients in need of eye care despite financial barriers. As you'll now hear from our ophthalmologists, your support and your generous funding enables us to work together to help those threatened with blindness and allow them to see again. Thank you very much.
Hello, I'm Christy Morse. I'm a pediatric ophthalmologist and a member of the Foundation Advisory Board of the American Academy of Ophthalmology. You have generously provided support for the iCare America program. The program provides free eye care to seniors and at-risk individuals who do not have the resources to otherwise obtain care. It connects these individuals with volunteer ophthalmologists close to their home who provide free eye care to them. This program has helped more than 2 million people. I'm an iCare America volunteer, even as a pediatric ophthalmologist, and the grateful comments I hear from the patients I see through this program remind me of the reasons I wanted to be a doctor in the first place.
My name's John Berdahl. I'm an ophthalmologist in Sioux Falls, South Dakota. I chair the Seniors Eye Care program of iCare America. And not only do I chair the program, but I'm a proud volunteer. It feels so good to take care of those vulnerable patients, the most vulnerable of our patients in our community, especially during times like this. If you're a senior and you haven't had an eye exam, you can reach out to iCare America through our website and hotlines and be connected with an ophthalmologist in your community to make sure that your eyes are okay, or oftentimes get the treatment that you need to prevent you from losing sight. Diseases we've all heard of, like macular degeneration, glaucoma, cataracts, are prevalent in people who are older. And so by seeing an ophthalmologist, we can find things like cataracts that are fixable, start to treat glaucoma, which is preventable and leads to irreversible blindness, or detect macular degeneration in some of its early forms and get the treatment we need to get people. You get goosebumps, you get tingles down your spine, and your soul fills up when you know that you give vision back to somebody who wasn't gonna get it because of your personal efforts and the efforts of people like the Knights. We are humans trying to help other humans be better humans. That's what being a community is, and the Knights enable that. I'm so grateful that the Knights have so much foresight that they want to support research and support where the rubber meets the road and actual people get help. For 35 years, we've been one of the most instrumental programs in existence to preserve sight. In fact, one of the most effective programs in all of medicine. We couldn't have done it without the Knights. And we're really excited to make sure that the next 35 years of patients get the care they need to. Thank you.
Recently, you provided funding for the Pediatric Iris Program, the world's largest specialty clinical data registry. There are over 72 million patients in the Iris Registry. This database helps to inform the natural history of diseases, the prevalence of rare diseases, individual practice patterns, and more in a real-world setting.
I'm a pediatric ophthalmologist, and I'm really privileged to have been involved with the IRIS registry since the very beginning. People like David Park at the American Academy of Ophthalmology had a vision of creating the largest repository of ophthalmic data anywhere in the world. And since that time, I think it's unbelievable how this has grown, really beyond what any of us would have imagined. This is really exciting because information technology has changed every aspect of the world that we live in. And what it does in medicine is that doctors are all using electronic health records to record patient data. The problem is that there's data here, there's data there, and there's really nowhere to bring it together. And that's what IRIS Registry does. It gives the individual doctor feedback about how they're doing on taking care of patients compared to other ophthalmologists all around the country. We live in a whole new world now because of advances in information technology. And I think it is enormously exciting that the Knights Templar has partnered with the American Academy of Ophthalmology to take advantage of information technology to be able to develop ways to take better care of kids and their eyes. And I've heard from so many members that the IRIS registry is the most significant thing that the American Academy of Ophthalmology has ever done to help improve care of patients. As of last month, there are over 72 million patients with eye exam data that's in IRIS registry, and that is absolutely remarkable. Okay, there's no other repository of medical data anywhere like that in the world. Okay, now more and more of those 72 million patients are kids. This is extremely exciting, and we all look forward to a day where pediatric ophthalmologists are going to be able to say that because of Knights Templar, the American Academy of Ophthalmology has been able to do something, for pediatric eye care that nobody's ever been able to do before.
And Sir Knights, the One Network has made an incredible impact on eye care as the global encyclopedia with digital access for doctors from anywhere in the world.
The One Network was developed by the Academy as a way to do online education, first for people here in the United States, but it immediately became evident that this was something that people could use both trainee level and practitioner level around the world to improve their own knowledge and hopefully translate it to better patient care. The One Network is only possible in the internet age because we need to have servers on which the data are stored, but we need physicians to write the content, staff to organize the content, and we need people to actually be interested in using the content. An interesting example is I was traveling in Vietnam on a mission, and the One Network was invaluable to me to see a couple of techniques that I thought would help the doctors there that I really wasn't experienced with here in North America because those were done by other specialists. Face-to-face learning, even for our residents, has gone away in the COVID era, and I'm not certain when it will come back. But the ability to access this content saves the resident, the fellow, inordinate amount of time because of the organization that's been done with the content. So I'd really like to thank the Knights for their support of our projects and the ongoing support of these really important tools that they've helped provide us.
The Knights Templar Eye Foundation Pediatric Ophthalmology Education Center was made possible through the generosity of each of you. The center was developed by over 200 volunteer pediatric ophthalmologists, and it launched in November of 2015. Among others, the center houses a strabismus, or crossed eye simulator, a simulator for retinoscopy, which trains doctors how to prescribe glasses for our pediatric patients who may not read an eye chart. And it also shows us case training in retinopathy of prematurity.
Knights Templar Eye Foundation gave a $1 million donation. The purpose for this donation was to create the biggest library of pediatric ophthalmology education. There was definitely a need of a good source, a reliable source that anybody and everybody could reach to whenever they wanted, and as easy as reaching out to your cell phone and retrieving the information. This website in 7 years became the biggest pediatric ophthalmology and education platform that was ever built, and has been expanding every day, if not every week. So if we had a simulator that actually, as if there was a patient in front of you, that actually depicted and showed you different conditions that you can master, I dare to say in tens of minutes, that it normally would take months, if not years, to really master, the simulator allowed us to do it. Right now, we have close to actually more than 1.5 million hits to this website from 215 countries. This has been an amazing platform for anybody and everybody that wanted to learn more about pediatric ophthalmology and give that back to their patients. The website traffic has grown approximately 15% every month since its inception. This is a huge number. It's an honor to be a part of this initiative. Thanks to the Knights Templars, we have achieved the goals beyond our initial imagination.
The site is free and open to the public. Each of you can access it, and I encourage you to do so and to take pride in what you made possible. Through the generosity of the Knights Templar Eye Foundation, you reach people throughout the country and around the world. Your impact is truly global and monumental. We are tremendously appreciative of the Knights Templar Eye Foundation. We gratefully acknowledge your generosity. Thank you to each and every Sir Knight for your support of the American Academy of Ophthalmology. You really are our partner as we protect sight and empower lives. Thank you.